This is Bob Dawson, Officer of Policy and Scrutiny. Unfortunately, our Deputy Monitoring Officer had to give his apologies this morning. I'm going to open this meeting of the Council of the Isles of Scilly Health and Wellbeing Board, which is being held virtually under the coronavirus regulations as described on the agenda front sheet. We will be, as you've heard, being broadcast on across the airwaves, and I'd like to welcome everybody here. My first order of business is to just take a roll call of who is actually present on the call, because we have a number of people on the phone and on webcam. So if I can go through names very quickly, and if you can confirm with your presence, that would be lovely. Okay, so I'll start. Councillor Williams.
Present.
Councillor Francis.
Present.
Councillor Grottick.
Present.
Councillor Marcus.
Present.
Councillor Smith.
Yes,
We've
present.
heard. Yeah. Ashling Khan. Jill Thornton.
Yep.
Thanks, Jill. Rachel Murray.
Present.
Tim Francis. I think will be joining us later. Paul Charnock.
Present.
Thank you. Karen Hodgin.
Present.
Catherine Fuller.
Present.
Rebecca Wigglesworth.
Rachel Wigglesworth.
Sorry,
present.
pardon, Rachel. Sarah Crane.
Present.
Chris Picken.
Yes, thank you.
And is there anybody else who's on the call who I haven't called out their name, please? Okay, I take that we've covered everybody who's on the call at the moment. I'd like to take item 1, which is the election of chairman for the Health and Wellbeing Board for 2020-21. Can I have nominations, please? Councillor Grottick.
I'd like to propose Councillor Joel Williams for the chair, please.
Okay. Do we have a seconder?
I'll second that.
Okay. Are there any other nominations, please? Okay. If there are no nominations, I believe that Councillor Williams, is everyone in favour, is elected chairman of Health and Wellbeing Board for the current year.
Thank you very much, Bob. Can I just check people can hear me?
A little bit.
Yeah.
Okay, I'll bring it a little bit closer. Well, thank you very much, everybody. It's a great privilege to be able to serve as chair of the Health and Wellbeing Board for another year. I hope we can combine together to create some strong outcomes. Before moving on to election of vice chair, I was just going to run through how I propose to conduct the meeting this morning. We've got 5 Part 1 reports to go through, the majority which Rachel will be talking us through. To avoid chaos when it comes to questions, I was going to suggest that we invite elected members to ask questions first, followed by all other partners to follow. If that creates any confusion or complication, then we can happily do it by roll call. If you wish to ask a question during the presentation, please feel free to put your hand up. When it comes to voting, we're using the rule that silence equals consent, but I will formally ask if anyone is against, and that can be recorded appropriately. If people are happy with that, we move on to agenda item 2, which is election of vice chairman for the ensuing year. Councillor Grottick.
I'd like to propose Councillor Dan Marcus, please.
I'd like to second that. Thank you, Councillor Francis. Any other nominations? I'll take that as a no. And in that case, Councillor Marcus, you are elected as Vice Chairman, if you are happy with that.
Thank you very much, Joel.
Jolly good. Agenda item 3 is declarations of interest. Councillor Grottick?
I'd like to declare that I represent the council on both the Cornwall Partnership Trust, and also that I have a family member who is involved with the Haven project, should that be discussed. Thank you.
Thank you. Any further declarations of interest people would like to table?
Yes, Chairman, Councillor Smith, just like to have a non-pecuniary interest that my wife is a mental health practitioner. Thank you.
Thank you. Any more for any more? Okay, I'll take that as a conclusion of agenda item 3. Agenda item 4, I have no urgent items. And agenda item 5 is minutes of previous meeting, which was held in June 2019. Although, just for the record, I'd like to say we had intended to have a meeting earlier this year, but it sort of was scheduled just as lockdown commenced and everything else was going a bit topsy-turvy, so that meeting was suspended. So apologies for any inconvenience that caused. But does anyone have any comments relating to the minutes of our last meeting last year, please? Are we therefore happy to take it as a true and accurate record of the event?
I'll propose that, Chairman.
Do I have a seconder? Thank you, Councillor Broffitt. Which takes us on, I think, to our first part 1 item, which is agenda item 6, Director of Public Health Annual Report, which I think is in the hands of Rachel.
Thank you. Good morning, Chairman. Good morning, everyone. So I'm bringing this report as a part of the statutory duty of the Director of Public Health to present an annual report. You'll see from that report that this was led by Dr. Virginia Pearson, who was in the Director of Public Health role during the previous financial year. So I'm presenting this report on behalf of the Director of Public Health role, which, as you all have known, I joined at the beginning of April into that role. But I'm delighted to be able to present this important report, which is, as I say, an independent report, which gives the ability of the Director of Public Health role to raise a particular issue or topic of concern. And this year this is planetary health, which I think you'll agree is a very fitting and topical and an important issue to present both evidence for the impacts of climate change and environmental change on human health, but also the impact of humans on that health of the planet and the interaction between the two things and how important it is to recognise the co-benefits of acting that address issues of planetary and climate change, as well as the benefits on health. So the report is written to present a variety of evidence and examples of mitigation of some planetary health degradation within that as well. So it has some examples within each of the sections of some activity in Cornwall and the Isles of Scilly. The particular chapters that it represents that are in that chapter, so air sources of air pollution, the particular challenge in certain areas, particularly of Cornwall, and not necessarily so much in the Isles of Scilly, but in terms of particulates and nitrous dioxide, and looking at the sort of interaction between clearly the respiratory health and asthma and other issues for humans of that air pollution and the potential benefits from addressing that through, for example, promoting active travel and different forms of transport. The water issue, another topic of the chapter, looks at the impact of agriculture and high nitrate concentrations and the efficient use of water, which clearly is something of an issue for the Isles of Scilly, and the importance of managing that to both clean water and protect sources of water. And then food, important elements around the food chain, both the way in which we eat, which has an impact on our human health, but also the way we use the planet, and make sure that we maintain our soil quality, marine life, biodiversity, and all of the important co-benefits of those things to humans. And then there's an important chapter on diseases, which will be relevant and topical for people who know the zoonosis, which is the interaction between humans and animals and the passing of diseases between them, and the vectors such as potential increases of mosquitoes and other tick-borne diseases where we see climate changes and increases in temperature, but also the interaction and the ways in which we live pass diseases between species, and of course, the example of COVID-19 as an example of that type of zoonosis. So preparing and being aware for the opportunity for different diseases as our planet changes is an important element of this. Clearly, it was written before the COVID pandemic, so that's not written large, but is clearly relevant. And then extreme weather, another chapter heading which gives examples of that and the impact across the planet, but clearly we have incidents of flooding and heat waves that we'll need to mitigate and manage to protect both human health and change the way that we live. And then the impact on communities and mental health is mentioned and outlined, including the distress of things like extreme weather, displacement, and environmental change, and the opportunities that conservation and working with communities to address that, and the ways that planning healthy places in which we can live clearly has some opportunities. So that's just a quick run through of the chapters within the report, and the recommendations within that are on page 6, which highlight 13 recommendations jointly with Devon and Cornwall, and these are what are recommended for action across both Cornwall and the Isles of Scilly, and include some pledges underneath that also on page 6, whereby people can take action to make a difference in line with the recommendations of this report. Thank you, Chair.
Thank you very much for that. Before throwing it open, I'd just like to welcome you to your new role, and thank you for all the efforts you've been to recently to support us, but also thank your predecessors as well, who, as you alluded to, have been part of writing this report. As stated earlier, I was just going to ask members first if they had any comments or queries to raise. In that case, does anyone else on the line have a question or comment to make on the report, please? Councillor Grottick?
Thank you, Chair. This is a very detailed report. Obviously, I hope that later we will be able to pull out from the report and perhaps have a little area of focus on the areas that are particularly relevant to Scilly. But I would say it seems an absolute given that we should be looking at human health and eminently sensible to link it to planetary health. So it seems that at this moment in time especially to be really relevant. And I'd like to commend everyone that's worked on this report. It seems to me very thorough and incredibly detailed. Thank you.
Thank you. Any other comments?
Yeah, Councillor Smith, may I make some comments?
Please do.
Yeah, I mean, just to say, as lead member of Environment and Climate Change, it's just really, really welcome to see this report. I think it was really well written, and I really think it's excellent. Should be adopted by our council in full. I was just going to ask a question in terms of, will these recommendations come to full council for adoption, Chairman?
I don't know the answer to that specifically, but there's no reason at all why they couldn't, I don't think.
Sorry, I was just going to say I would commend them to, because I think it completely is in line with our adoption of the climate emergency. It makes a hell of a lot of sense, really.
Chairman, I think we'll have recorded that in the minutes for this meeting, and yes, we'll take that forward with the consideration of the monitoring officer.
Yes, thank you very much. And I just also, sorry, Chairman, if I may, I was just going to also just quickly comment on point 13. I think it's very good in terms of individual actions. I would sort of say that it really only scratches the surface in terms of what we need to do as individuals and society to cut our carbon footprint. These cuts of carbon have to go really deep, and it won't be easy or comfortable, but, there is no other option. So I really commend the principle of individuals taking action. And so look forward to kind of developing these in time, and again, really welcome this report. Thank you.
Thank you. Certainly, minutes of Health and Wellbeing Board will go to full council, so there'll be an easy opportunity there to flag up the recommendations. And also, I can do a lead members report, which also captures that. So there's probably 2 or 3 routes we can get it onto the table at full council for further discussion.
Thank you.
Chairman, I think the Director of Public Health would like to come in.
Thank you. I was just going to share with you that Cornwall Council has asked the climate change team to respond to the recommendations as part of including it in their action plan. So that's, I'm not sure if that's something that you'd want to do as well. And then the other, I guess, issue could be clearly as people are moving into a recovery phase, that some of the benefits that people might have seen in changes in behaviour through the coronavirus pandemic, that is looked at in terms of the carbon reduction potential in recovery, in any recovery planning phase. Thank you.
Thank you. Councillor Marcus, did I see your hand was up?
Dan, you're muted.
Let's try that again. Yes, I was just going to reiterate what Rachel was saying. We can, option 3 of the recommendation states that we will build actions around this report. We can do that with climate change, and we can also do that with the renewal of the corporate plan for next year as well. So I would recommend that we choose option 3. We support these recommendations and identify specific action to support these.
Any further contributions any other partners would like to make at this stage?
Chairman, it's Bob here. May I make one comment, please?
Yes.
Just in terms of the contribution that Emma McMaster made to this report, she was the kind of link with the Council of the Isles of Scilly early in the spring, and it was an unfortunate time because this is an area I've got particular interest in as well, but we had down one senior manager and there was a lot of pressure on the other two to pick up the reins. So I think it was Aisling Khan was able to contribute something which very, very grateful for. But yes, I think this is that's just what I would like to bring to the committee's attention.
Thank you very much. So before moving on to recommendations, I was just going to check if anyone else in the virtual room had any other contributions or comments to make. In that case, if we take the two recommendations together, do I have a proposer and seconder for those, please?
I'd like to propose that, Chairman. It's Councillor Francis.
And a seconder?
Yeah, Councillor Smith.
Thank you very much, both of you. Thank you very much, Rachel. It's been a very useful report for us to see this morning. That moves us on to agenda item 7, which is the COVID-19 outbreak monitoring report on pages 8738 of your report, whether it's virtual or not. And is that you taking us through it again, Rachel?
Yes, thank you. There's a number of items of information in this paper. So the intention is to provide the board with some oversight of the work that has been undertaken in response to the pandemic, both in terms of the public health response and the surveillance and understanding of the pandemic and how it's affected people. So this report brings together a number of presentations that have been being used across Cornwall and the Isles of Scilly to do that and to have oversight of that. So I think what I'd like to do is to run through some of the contents of the appendices and then go to the outbreak management at the end, because it sort of gives that oversight of the situation and the number of infections and how it's affected the population in Cornwall in particular. So if we could start by just, if you have it in front of you, I'm not going to project it, I don't think, but if you could open Appendix 2B, just to give you oversight of the surveillance and intelligence of the coronavirus outbreak, that would be easier if you have that in front of you. So this is a report that Public Health has been producing regularly to give that oversight of how the disease has affected the population. This particular dashboard was produced on the 7th of July, So it's not the most recent, so I'll just quickly update you on the impact of and the numbers of people affected. And this is all publicly available information that's available on the .gov.uk website. But over the whole course of the pandemic, we've had 902 cases. So this report says 889, but that's currently, as of today, 902 confirmed cases. Clearly, there will be many people who have been infected and were asked to stay at home and testing wasn't available early on. So clearly that is an indicative number of the number of cases in Cornwall, but clearly that's what all other areas are using, and we gives us an indication of how our population has been affected. The confirmed deaths, which is through the Office for National Statistics, that any resident of Cornwall and the Isles of Scilly, and that is just for Cornwall, have been affected, is now 207 deaths overall, which is currently one of the lowest rates in the UK. So we have the third lowest rate of COVID cases of all upper tier councils, and clearly that's for Cornwall, and then we continue to have rates that are significantly lower than the rest of the southwest, and as you will know, the southwest has been affected much less than the rest of the country. So we are lucky to be in that situation, and I know that the Isles of Scilly have not had a confirmed case, but are always aware of the potential implication of that. But this is a report which covers both populations. So just a few points on that. So we know that we have more males affected and died from coronavirus as recorded in the death certificate than females. That is something that's consistent across those deaths in the country, and as we've seen, there's other ethnic relationships as well that are being assessed. You can see by the trajectory the way in which the peak of the pandemic was for Cornwall around the second week in April, slightly later than some other parts of the country. But the course of that, clearly we're into that July, and we have the thankfully very low numbers of confirmed cases currently, which we're managing, just 5 confirmed cases in the last 5 days. Clearly there are cases around. We have people are reporting some symptoms, and the access to testing is the most important thing. But clearly there is testing available, and there's over 2,500 tests being done in the last 7 days, which does include care homes. But that is clearly, it provides us with that surveillance around the situation. So currently, clearly we're wanting to track and test and follow up any cases so that we can continue to suppress the numbers at the moment. So a little bit more information, as you'll see in that dashboard, which looks at places of death, which are clearly a higher number in hospital, but also those in care homes, so that's clear. And some deaths occurring from COVID at home as well. So we do have that full picture. And as I said, at the bottom there's a chart which compares the rate of death by unitary authority, so comparing those upper tier councils from March to May, and that death rate is the second lowest in the southwest. So lots of information in there, but I just wanted to take you through that in order to present to members the sort of overall situation and impact of the pandemic on those high-level sort of metrics. So unless there's any questions, I was just going to move on to just a summary of that 5-test dashboard. So this was another, again, a way in which we were measuring the capability in Cornwall and the risks to Cornwall in coping with the impact of coronavirus. And the 5 tests, if you remember, the government tests that they set out in order to release the restrictions on the population and people returning to work, and as we know, and tourism in the last few weeks. So these we continue to measure these, and it's not an entire science, but we tried to do that. This again was published from the 2nd of July. So some of these numbers are slightly out of date, but the RAG rating for each of those 5 tests remains the same this week. So the tests are that the NHS can cope. So we've used things like the use of hospital beds and calls to 111 and other indicators to say at this current time the NHS can cope. Test 2 is that there's a sustained fall in the death rate. So clearly on this week we can see that and what I told you today, you can see the evidence of that. Test 3, infection rate fall, we put that as still remaining amber because clearly there are continuing cases. It would only be green if we would, in the case that there were no cases and we'd had eradication, so that's likely to remain amber until the point at which we have further immunisation and containment. And then test 4 was to ensure that there was a supply of testing and PPE to meet any current and future demands. So this was clearly a concern, and you can see the red blocks earlier in the earlier weeks that we were looking at, but this is currently continues to be, this is a green situation at the moment. And then finally, the risk of a second peak was the test 5, and this talks about the easing of the lockdown restrictions and the measurement of cases and deaths and monitoring daily to see what the change is, and we've continued to put that similarly in an amber status. So that just gives you an idea about how the range of different ways in which we measure the situation and the capacity to deal with that. They might be blunt tools, but that's just some examples. And then moving on to the current situation. So in Appendix 1 is our Cornwall and Isles of Scilly local outbreak plan. This is a plan that was an approach that's a national approach asking local authority, upper tier authorities to lead with across their area a production of a plan which articulates how different agencies are going to work together and understand the responsibilities in the current situation where we might have small outbreaks or clusters of cases and how we respond, we prevent those, and if where testing identifies that we have a number of cases, that we act appropriately and have our plans ready and we are exercising them, and that partners know whose responsibility it is, and we use local expertise as much as possible to work with communities to do that. So some of the members of this board today are involved in the local outbreak engagement board, which is the political oversight of this approach of outbreak management. And there's also another board that's articulated in this plan, which is a more technical health protection board for Cornwall and the Isles of Scilly. So the governance of this plan is through those two boards, and underneath those two boards there's at the operational level that public health are leading across both Cornwall and the Isles of Scilly, which is on page 10 of that local outbreak management plan, showing the incident management group and the response teams. And many of you will know there is a specific incident response team with public health involvement and emergency planners and members from Council Isles of Scilly. That is for the Isles of Scilly specifically, and we consider the Isles of Scilly as a unique setting, so that cases any cases identified in the Isles of Scilly will be responded to as if it was an outbreak, even if it's one case where that is confirmed. Clearly there's exercising of that as there are potential cases or suspected cases, and that has been something that is helpful to test a response. And exercises, I think, have already, have been set up in the last month with Isles of Scilly to develop the evacuation plan, which I know is being considered by other committees. So this is the sort of full oversight of that plan. The important parts are to, obviously continue to present the prevention messages, which whilst we're maybe people have heard it many times, but it's important to keep reinforcing and changing the way in which we deliver those messages through our communications. So hand washing, social distancing are your most effective measures to protect yourself and other people. So include those in all of our messages in different ways through all of our communication routes, and that we implement this contact tracing approach, and then the outbreak control and outbreak management response through these teams. So rather than going into a huge amount of detail, I hope people have the opportunity to read that plan. and I'm happy to take any questions or go into further detail on any specifics that people would like further information on. Is that enough for now? I should go on.
That's sufficient from my point of view. It goes without saying, but I think on behalf of our community, we'd like to thank all professionals, all volunteers, whether it's been at a strategic, operational, clinical, or anything in between, who've in some way helped us to stay safe and support our community. And just to remind people that our engagement board is meeting this afternoon. And on that note, has anyone got any questions or queries they would like to raise?
Chairman, it's Councillor Francis. I would just like to endorse your comments. Thank you. The efforts that have been made to try and look after our community in this crisis. And I know through the various other meetings that I attend throughout the southwest and further afield that we're actually held up as an example of how people should prepare. And I just want to thank, as you did, everybody, all our health professionals. Just like to thank all of you for your efforts for Scilly. Thank you very much.
Thank you. Councillor Marcus, did you raise your hand?
I did, yes. Echo those thanks. So I'll start off with Kristen first. That paper, I think, is just copied and pasted from Cornwall. There's some Cornwall-specific references in there, so it would just be good for the future to make sure that the papers are actually written for us. Is that okay? I totally appreciate everyone's stupidly busy at the moment. I wanted to ask just about track and trace, because that seems like the cornerstone from a lame person's point of view about how we're going to fight this infection. I've seen reports in the media that the track and trace program nationally is missing 50 to 60% of contacts. How is that working in Cornwall and the Scilly? I think that's Rachel, sorry.
Thank you, Dan. So yes, I note that there might have been more Cornwall references in the reports. I think in the main that's also because the cases and situations have related to Cornwall. So I think it's otherwise we wouldn't have much to put in for specifically for the Isles of Scilly. So I think it wasn't certainly something we'll make sure that we are aware of in those reports in the future. So just looking up the sort of specific data around our test and trace. So test and trace is NHS Test and Trace is a nationally delivered programme that contacts people who've been tested positive and engages with them to try and identify who they've been in contact with in the preceding days, and then to make the contact with those people to warn them to isolate and self-isolate for 2 weeks. So clearly it's an important part of our response. That also works very closely with the Public Health England outbreak management approach, and of course they're the experts in this. They do this every day and they respond to all sorts of different infectious diseases as well as COVID. So they manage the more complex situations that might include care homes, sort of schools or other contexts that would require a more complex response and are about a group or a cluster or an outbreak. So just to make that distinction. The NHS web tool, which is part of this the test and trace tool, we get reports on that daily as to the numbers of cases for Cornwall. And to date, and it started on the 28th of May, 80% of those confirmed cases have been engaged in the contact tracing process. And they then obviously have to follow up with the actual the contacts themselves, and that is where the uptake is slightly lower. And nationally, there's been some criticism about that 50%. In Cornwall, and those cases at the moment is slightly higher than that. It's 57%. But what we have is raised this with our national colleagues and the Department of Health and Social Care. And just yesterday, we have been promised that local authority public health teams will be able to receive the information on these individuals that haven't been able to be followed up in order that we can do that ourselves. This has been tested in Blackburn, where they have put some local restrictions, but not as full as Leicester. findings are that that's been a successful way where local sort of teams can approach people in a sensitive way and perhaps get access in a way a national call centre can't. So we're really delighted that that has been announced. So we intend to, we're just waiting for the data to arrive. As we say, it's announced yesterday to Directors of Public Health. So we're really pleased that it means that the role that we can take to continue to do this effectively may have a real impact.
That's brilliant. That's reassuring that the response has been more localised, especially in areas of big transitory populations, basically, because we're going to have people moving in and out within a week or 2 weeks, aren't we? So those contacts are going to be...
Morning, Sarah Crane, Devon Cornwall Police.
Those contacts are going to be a bit more...
Is now exiting.
Harder, more nebulous to trace, aren't they, than rather in a community. That's it from me. Thank you.
Do I have any other questions or queries people would like to raise, please?
Yeah, Councillor Smith. Thank you. Yeah, good report. Echo comments made by Councillors Francis and Marcus. I really want to just check in terms of that RAG rating on the potential for the second wave of infection. Just wonder if you could comment, Rachel, on in terms of the likelihood and the impact with your current understanding, please. Big question, I know.
Yeah, certainly on the spot there. So clearly there's a lot of uncertainty about this. We are just over 2 weeks into the introduction of tourism and people's the loosening of restrictions, and I know a lot of people will have seen changes in behaviour. So you would expect to be seeing some changes in cases by now in the sort of transmission period. We currently haven't, and we're tracking that daily, so we'll be looking and encouraging testing and symptom awareness. But currently, the situation is that we don't have that significant increase in cases. Like I said, 5 in the last 5 days is confirmed. That's our current situation. We do have some work with the Exeter University to look at some different scenarios that could play out, and the trajectories change around the end of July and will show perhaps the direction of travel if there is a change. But we hope that we're in the sort of best case scenario, continuing to manage and respond to any clusters where they appear. And this is the importance of this outbreak management, of clearly living with the virus, that we wouldn't want to return to sort of the very severe restrictions that we were living under, but to use that outbreak management and really quick response where we're shutting down any cases and managing that appropriately is the way in which to manage the future. So I can't, with any sort of certainty, say that we won't have, a future increase in cases, but we're doing our best to make sure that we do protect people as far as possible. And clearly, we're going to be reviewing that, and you'll know that there's powers that have been agreed and delegated to local authorities, which will be the Chief Executive with the Director of Public Health and the Head of Environmental Health or Public Protection, that will work together to use those powers if we need to and they are for dealing with 3 particular scenarios. One is a closure of premises, if that was required. The second one is that we could cancel public events, and the third one is restricting sort of outdoor spaces. So there might be the use of those if it were required, and we would use all of those locally before any escalation to a national situation within Cornwall and Arthur Scilly. But we hope to be able to do that. We hope to be able to avoid that, but we know that the powers are in place to respond quickly if we were to need to use those. So all of those tools are there, and I hope they will be used wisely in the coming months. So that's I'm not going to give you an answer, but that's my best sort of response to your very valid question.
No, thank you. Clearly, it's something everyone will be keeping a watching brief on. So, thank you for that so far. Thank you.
Would anybody else like to come in at this stage? I'll take that as a no. So we have one recommendation which is as our board notes progress made on Philly to establish a comprehensive and timely COVID-19 outbreak management response. Do I have a proposer and a seconder for that recommendation, please?
Yeah, I'll propose that, Chairman. Councillor Francis.
I'll second that.
Thank you very much indeed. And that moves us on to agenda item 8, which I think is you, Rachel, again, which is our joint Cornwall and Isles of Scilly Health and Wellbeing strategy.
Thank you. So I've also got a colleague joining us for this item, Anthony Ball. So I'll introduce this and then hand over to Anthony. So you, I hope, remember that we held a workshop last year, around this time, I think it was, to work together to agree a joint health and wellbeing strategy for Cornwall and the Isles of Scilly. And a lot of work was put into developing this framework, which you'll see in the paper, which came through using the joint strategic needs assessment. You see some of the population health summary that's attached. It is incomplete, but it's very nearly there. And this forms the basis of the topics and the priorities in the health and wellbeing strategy. So the workshop in the Isles of Scilly last year, along with other workshops in Cornwall and with other stakeholders and board members, informed the development of that plan on the page. And we had intended to bring this back very swiftly in I think it was September, to the boards, but they didn't go ahead. So this is the first opportunity that we've had to bring that back. The strategy, which remains an important framework for the continuing work of the board and how we approach health inequalities and the priorities, to try and frame, I think, how the board can work together as a sort of partnership board to address the key issues, the key health issues for your population. So I feel a really important part of setting the future agenda for the Isles of Scilly and working jointly with Cornwall as well on some of those priorities. So I think in terms of the sort of next stage of where we're at, I might just ask Anthony to sort of come in and describe that, to say some of the intentions in terms of timescale have been slightly, put to one side during the last 4 months. So Anthony, can you? Thank you.
Okay, thank you. Thank you for inviting me here today. Just to sort of say, I think we've put a draft timetable of having a virtual workshop in for sort of September to December this year. And I think in the recommendation it talks about that is to be confirmed.
Is now exiting.
It obviously is deferred or has been delayed because of COVID-19. Also, we're obviously trying to work out, can we physically do it, as in physically attend, or can we do it virtually? So we set that out in a recommendation to say, will members agree to have a virtual engagement session to then identify how we actually take forward the health and wellbeing strategy from the plan to actually have it as to like a sort of 1 or 2 year delivery plan to see what differences we can make in the short term, and then obviously set out those differences that can be made in the sort of longer term. The other reason for doing that is obviously COVID has sort of changed to a degree everything, so we need to look at that and make sure we've got a commentary in the health and wellbeing strategy to reflect what has happened and what has changed, and ensure we can sort of deal with that situation, as well as make sure that the inequalities that were perhaps there before COVID are not widened, and any actions we do are actually there to make sure that that gap is continued to be closed. The document also sets out various appendices, which sort of builds on, as Rachel said, the engagement that was carried out last summer, and just sort of summarises that information to say these are the responses, this is the feedback we had at that time, and it will be using those appendices and the sort of stakeholder session to sort of really take that forward. And so those recommendations are set out there in the report today for your consideration, but happy to take any questions.
Thank you very much. I'm certainly conscious that in some of my conversations with individuals, we've been speaking more about loneliness, isolation, damage to emotional health policy, none of which sounds particularly positive at the moment. But I think we're absolutely right to bear those in mind on an even more enhanced basis as we move forward. Do any partners or members have any queries or questions at this stage, please?
Unknown participant is now joining.
Well, it doesn't sound like really specific questions, but I'll be certainly keen to move forward with the workshop. I think the strength of this overall strategy is that Silly has a bespoke section, so it's how we capture some of those bespoke issues which we experience. And you're thinking that's going to be towards the tail end of this year, Anthony?
Yeah, I think we're sort of saying, I think, I can't remember what page it is on the document, we sort of say September to December we would look at having a workshop. As I said, if we can do that face-to-face, that would be brilliant. If not, it'll end up being virtual. But yeah, in that sort of timescale, because then obviously we want to get a delivery plan in place fairly quickly to start moving ahead with that, to partly respond to COVID and partly to continue to respond to closing the inequalities gap.
We do have a Health and Wellbeing Board scheduled for September. Whether it's possible to combine the two, I don't know, but it could be something we look into.
That would be a good idea, I think, because if it's already scheduled, then it'd be a good idea to build on that. So, yeah. I can liaise with Bob about that, can't I?
Sorry, Chairman, as Councillor Smith, I did have 3 brief comments, if I may.
Please do.
Yeah, firstly, just obviously welcome the report, thank you. Firstly, in terms of both mitigation and adaptation to climate change, especially in the light of the excellent report on Gender Item 6, just sort of suggest that there could be more link-ups there. Secondly, that healthy diet be more explicitly considered. And thirdly, that the connections be made to the new local nature partnership environmental growth strategy, because there's a lot of discussion there about access to nature as being essential to human well-being and health, and that's a really strong emerging theme. So I really sort of encourage that link-up. It'd be very worthwhile. Thank you.
Okay, yeah, thank you. Definitely make those links.
On that, when we have our workshop, it would be totally appropriate to invite people who aren't part of Health and Wellbeing Board, but who might be able to offer influence, so we can stretch our knowledge pool, if you like, Anthony.
Yeah, absolutely, because obviously health and wellbeing goes across literally everything, so the more input we have, the better, I think, and the more wider input. And obviously COVID, unfortunately or fortunately, has shown just how critical health is to the way we operate anyway, so yeah, absolutely vital to have as wide and inclusive amount of people there. So yeah.
Well, certainly, Chairman, I can make those links between the local nature partnership and Health and Wellbeing Board, as I'm a member of both.
Thank you. Rachel, did you wish to come in?
Yeah, I think I just wanted to reiterate that we do have a draft profile for the Isles of Scilly, and this is one of the important parts, is to have something very specifically for Scilly, and then the action plan and the implementation plan that Anthony explained would be around prioritising key issues from that framework, from that plan on the page, which, we have tried to focus, but clearly, it's still very broad, that you could pick up, as Councillor Smith has identified, your top 3 things that you want to talk about, environmental well-being or diet and food as particular issues. They could be drawn out of those themes, and that would be the focus of that workshop, is making it tailored for you based on that profile, your local needs, and then the key issues where you feel that you can work together to have a greater impact, because clearly this isn't about a new investment of a whole range of resources. It's about joint working, it's about best opportunities and focus, so that rather than sort of looking at all of the health and wellbeing issues in one go, that there's a clear progress in those first 2 years. And this is a 10-year strategy. This is the aspiration of where we want to be in 10 years. So we need to start by having some clear and focused agreed actions that you can then report back to the board and see some real movement. And I feel like it would give a real impetus to the purpose of the health and wellbeing boards themselves. Thank you.
And again, clearly from our perspective, we need to ensure that as we talk about our local authority corporate plan, we have complete connectivity between us, and that would be peculiar if there wasn't significant linkage between the two. Have I got anyone else who'd like to make any comments or queries at this stage?
Councillor Grottick, I think, Chairman.
Thank you, Chair. just to say that if we wait until September, we'll have a little bit more clarity about some money that might be coming from central government. Will be channeled through the local enterprise partnership to do with retrofitting housing, which is obviously one of our key issues, is housing, and the work that Anthony previously did around fuel poverty and in insulating housing. So that would be a good link for joint working. The money will come to Cornwall. We're not in a position to bid for it at the moment, but there is some hope that we might piggyback onto the Cornwall work, and I think they're quite open to that. So that would probably be quite useful. Thank you.
Thank you for that.
I was going to say, Joel, Councillor Williams, if I could add to that point, I think I'm due to attend a meeting. I think Nicola Stinson's going to there as well, which I think is coordinating all the sort of retrofit work. And I am continuing to do the fuel poverty work as well. And I think Inclusion Cornwall will be coming across the Isles of Scilly on about the 9th, 10th, 11th of September, I think, to make sure, one, we're prepared, obviously getting prepared for winter, and also getting prepared for any response to COVID, but also trying to build on the new Green Homes grants that were announced by the Chancellor, because obviously that's another opportunity for the Isles of Scilly as well as Cornwall to benefit that perhaps in the past it hasn't been able to benefit from. So yeah, that would obviously be all part of our health and wellbeing approach as well. Okay, thanks.
Thank you very much. I'm delighted to hear all that. Last call for any queries or comments from people. In that case, if we move on to the 5 recommendations, which I'm proposing to take on block, do I have a proposer and seconder for those recommendations, please?
Councillor Smith, I'll propose.
I'll second those.
Thank you so much, Councillor Marcus. Agenda item 9 is our mental health strategy. Tim Francis, I think, was presenting this. Tim, are you with us?
I am, Chair.
Ah, jolly. Can I hand over to you in that case, please?
You certainly can. Thank you very much. I'm just taking my seat next to a very bright window. I'm going to be a little bit blinded. Okay, thank you. Good morning. Can you see me online? Okay, great. What you should have seen circulated prior to the board meeting today is the final iteration of the adult mental health strategy for Cornwall and the Isles of Scilly. It represents a 2-year piece of involvement, engagement and listening to understand the needs of the population, to understand how people would like services delivered, with the overarching objective to improve mental emotional well-being and enable people to have fulfilling lives, happy lives, and receive the parity of esteem in terms of service delivery that other people would expect across acute pathways, for example. Just stepping back a bit, the process started in October 2018 with a formal multi-agency workshop where I think there were representatives from the Isles of Scilly present, which was fantastic. That launched the development towards our strategic intentions. We launched a draft strategy in May 2019 at the Health Watch conference, which coincided with World Mental Health Day. We had a big event down at Lemon Key, and we had a phone-in on BBC Radio Cornwall. Just prior to that, we commissioned an appreciative inquiry using the recognised methodology to draw out from people using services and those delivering services how they see the future developing, so with an intent to really develop from the bottom up some of our intentions. In October 2019, we started the formal process of engagement and listening, and we received a number of over 50 survey responses, which was fantastic, and we have incorporated all of that feedback into the strategy, of which some was around complex needs, making sure that we're picking up complex individuals with maybe a mental health need and a substance use need, for example, or a mental health need and an autistic spectrum condition. Also veterans as well. There was a point that we hadn't described the offer in terms of support for veterans, which we have, and also for the more specialist areas around parenting and mental health, for example. So we enhanced those areas too. We have had endorsement from the Chief Executive of Mind, Paul Farmer, which is fantastic for Cornwall and the Isles of Scilly. In his words, it puts our community ahead of the curve nationally, and I think I am extremely proud to be here. This is a co-produced piece of work. Our ambitions are that people will feel supported and able to access care and support, that people will have improved choice of the support that they receive and where and how they receive it, that people have the ability to personalise their support. We've talked a bit in the strategy about the application of personal health budgets, for example, and also people will live longer, healthier lives with more positive outcomes. The strategy also describes the national mandated must-dos, which are represented in the NHS long-term plan for mental health, and they will include areas of enhancement of very recognised pathways like the crisis pathways, the 24/7 psychiatric liaison support, and talking therapies, improving access to evidence-based talking therapies, much of which is already underway, with some quite impressive outcomes noted already. There are some specific bespoke needs to our communities, one of which was a gap, which some of you will remember, was around the adult ADHD treatment pathway, which we've now commissioned into, so we've closed that gap. Another, previously 2 years ago, was the lack of an integrated offer on the Isles of Scilly, to bring together services, represent those with some quite complex needs, and ensure that they have more positive and sustained outcomes, which is now in place and is commissioned recurrently. We have benefited from a refresh of the Joint Strategic Needs Assessment. Obviously, that was a starting point, and the needs are well set out in the strategy document. I hope you'd agree. Some initial feedback was that it wasn't as easy on the eye as it could have been, so we've rejigged all the artwork in the strategy itself with certainly an easy read approach to much of it in terms of the infographics that we've used. The next steps for the strategy, if the board endorsed today, will be to move to formal ratification. The next step is to take the strategy to the Health and Wellbeing Board for Cornwall Council, and then to develop an implementation plan and outcomes framework, which we hope to do by the end of September. We've already started that work with public health and a range of other stakeholders and partners, and I'm pleased to say that the implementation is already underway. We've been brought forward a number of key priority areas, one of which is the development of a single point of access, and one is the expansion of our IAP services in response to a likely surge in demand, which we're predicting to hit end of summer, early autumn, and probably last a year by all accounts nationally. We're ahead of the curve on that as well in terms of our analysis and the heat mapping and activity data analysis. Another area where we have I think improved the commissioned offer is in embracing some of the new technologies, some of the data to enable us to deploy a new offer, which is on the mainland, and there's a virtual offer, which is the Crisis Cafe 24-hour support, which has pop-ups. Now, the plan will be to do a pop-up on the Isles of Scilly, so a mobile Crisis Cafe, which offers bespoke support to people who might not meet normal thresholds. It offers a discreet support to people within their communities, particularly rural communities as well. That's a new offer, and we've used the new IT systems to inform that planning, and we can turn that around really within a week. So if we see demand or a hotspot emerging, we can meet that. Outcomes is extremely important, as I think we'd all agree. The measuring of outcomes, not just qualitative but quantitative, we are tackling, and we hope to be able to measure each and every one of the outcomes expressed in the strategy moving forward. Again, that will be set out within the outcomes framework, and we will report into the Mental Health Board in terms of the activity. So the Cornwall and Isles of Scilly Mental Health Board, which reports up into the Collaborative Communities Board, will be the vehicle for driving the implementation of the strategy. There are a range of subgroups that sit below that. We've just established a brand new co-production subgroup, which is going to be chaired by Health Watch to keep us all to task when it comes to co-production, to ensure that we really do adhere to. So services designed by the people who are going to be receiving them, and certainly in terms of the operation. So that's a fantastic new established function which we've set up in the last month. And another is a mental health thematic alliance, which is a coming together of the chief executives from a range of voluntary sector organisations. They are going to be pivotal to establishing more integrated community-based offers for people with maybe emerging mental health conditions to ensure we early intervene and prevent, but also those leaving services, hopefully towards their own recovery. So it's a connecting of all of the assets across our communities. I'm conscious, Chair, that I haven't got a lot of time on this item. I hope I haven't rambled too much and tried to keep these things as succinct as possible. There's a thread running through the strategy here, which is moving away from a medicalised, disease-based model to very much a psychologically based model, which views the whole person within the whole community as the focus here, and a reliance on a very specialist mental health service in the future will be hopefully something that we don't see. We see local services in local communities being delivered by a range of different providers. But I'm happy to take questions on that one. Hopefully people have had a chance to look through the strategy as well.
Thank you very much for that. I found that a really bit of feedback. I found that a very useful read. I was just wanting to pick up a little bit on the split between children and together. Resource, how you resource to take forward some of these ideas, and also whether COVID has increased the workload you're seeing on the ground over the last few months.
Absolutely, yeah. Fine, so we'll take that from the top, Chair, if I can. In terms of it's an adult strategy, yes, it's 18 plus. The reason for that was that there is already a strategy across our system, which is One Vision, which sets out the strategic direction of travel for younger people. In this strategy, we talk quite clearly about the need to focus on the transition between, for those young people between 16, 17 and 18 years old, there's going to be a particularly strong focus on those transition points. We're also focusing on the 0 to 25 age bracket to maintain synergy with the national expectation, because we do believe that is where prevention should be occurring. We should be targeting as much of our specialist functions at that age range to prevent chronicity and to prevent as many people as are now transferring onto adult pathways. So we'll be working with Meredith, the Director for Children and Young People Services, as well as her mental health commissioners, to ensure that our intentions are as joined up as possible. At a governance level, there is representation across the board, and it's all age. We speak all age, but the strategy is an 18-plus strategy, Chair. In terms of the resourcing, yes, there is a system-wide commitment to adhering to the Mental Health Investment Standard, which is a national expectation to increase year-on-year investment into mental health as a percentage of the overall investment that we put in across the system. So I think last year, 2018-19, we put in just more than 4%. In addition, last year, I think the increase amounted to circa 3.6 million pounds of investment, of which went into adults. It was just shy of £2 million of additional investment. So we are increasing investment year on year. We are seeing tangible differences and some very positive outcomes already. Some of that money has gone into expansions of crisis services, expanding talking therapies, trauma services, enhancing the third sector offer as well. So, it's coming together with recurrent investment. There will be a conversation to be had about the Better Care Fund and how we might use that in terms of the personalisation agenda, but investment is there. We've also been active in targeting the capital investment streams that come down from the centre, which we've been successful in securing. And only last week we've secured money to enhance the bereavement support service, for example, and prior to that, additional investment to support the perinatal mental health service and the crisis service in securing the purchase of some new vehicles to rove around our communities, which is fantastic. So I think that responds to the first 2 points. In terms of COVID, the within the incident management structure, we had established a mental health and suicide prevention cell, which reported up to IMT and then up to core group. Our objectives were clearly set out in terms of population wellbeing, ensuring the access points to pathways and pathway functionality, understanding the phasing and flexing of services in line with national the national expectation, but also the workforce wellbeing as well. We had seen a decrease in activity across all service lines, commissioned service lines, up until a month and a half ago, when we have now seen a steady increase across all service lines, particularly the acute service lines, where we're seeing more acutely unwell people coming in to hospital. We did see 3 people actually go out of area for very specialist intensive care. Acuity's gone up, so people are presenting more unwell, despite the best efforts to deliver the assertive outreach. At the moment, we can't measure the correlation. We don't know what's causing that, but we have a task and finish group looking specifically at that. So activity is increasing across most lines now, and it is predicted to go up month on month.
Thank you for those responses. Can I invite any other partners to raise any queries, please? Dr. Pickin?
Oh, sorry, I shall let Fran go first. I think she has her hand up first. Sorry, Fran.
Are you sure? Just 2 quick comments then. I was pleased to see a note about veteran support. We don't have high numbers of returning veterans on Scilly, but in our particularly isolated situation, I think it's very important that we give them the care and support that they need. And secondly, I'm sure the board will be very happy to work with you to make sure that the level of response you get from the islands is of enough numbers to make it pertinent. And you will know that a local solution was put in place due to support from the Better Care Fund. I think several of us are quite concerned that the Better Care Fund, I believe technically, is to close next year, and we certainly hope that we can all work together to try and encourage politicians to keep it going. Thank you. Thank you, Dr. Pickin.
Thank you, Councillor. If I can respond, thank you for those comments. Yes, we benefited from a good deal of engagement over the last 2 years from council members, portfolio holders, and from stakeholders and partners, including Dr. Pickin there, who put in a lot of time in talking with myself and others around what will work for the island community. So a huge thank you to everybody who's put in the time, and particularly Bob, who has helped me on my visits over to the island. So absolutely, we'll maintain that close engagement. Thank you.
Dr. Pickin, over to you.
Yes, many thanks. I think actually Councillor Gothic has said exactly what I want to say. And again, I would just echo to Tim and to the commissioners and to the council my genuine thanks for what you guys have done in helping us set this up here. It is absolutely invaluable and gets excellent, absolutely superb feedback. And again, as Councillor Gothic has said, I would absolutely love to see this being part of the strategy going forward, if at all possible. But mostly, Tim, thanks to you guys and to the council. Many thanks as well.
Thanks, Chris. Thank you.
Would anyone else like to ask a question at this stage, please?
Yeah, Councillor Smith. Yeah, thank you for the report, and very interesting going through it there. To me, it really stood out how serious the situation for mental health is in the region. So it really merits some very close attention. I know everybody in here, will obviously understand that, but I think just as a general statement, mental health is still massively underestimated in its importance through society, and I think all of us here must take responsibility for changing that for the better. And it was a very interesting discussion there around the kind of impacts that the pandemic might have, and really good to hear there'll be more support for mental health, which will undoubtedly be needed over the coming months and perhaps years. And just really to say that I think when we talk a lot about recovery from coronavirus. I think we've got to broaden that out from just financial to the physical, mental health, and the health of our environment as well. I feel kind of very, very important themes for us as society going forward. So very much welcome the report. Thank you.
Thank you very much. If I can comment, very much appreciate your comments. Thank you. Yes, we're working in daily collaboration with our public health colleagues, and Rachel will acknowledge that. What we've been able to achieve over the last 4 months in terms of our proactive response to COVID-19 are a set of bespoke self-help guides on the council website via their portal, which offer individuals the means of self-helping, yes, but also knowing where to go for support. We've extended a 24/7 telephone helpline for anybody that feels in distress or worried or in crisis. That's being provided by CFT. We've also linked that right through to third and voluntary sector. So, I mean, what's been achieved has been fantastic, and it's testament to the hard work and commitment across our counties for people's well-being. It is very, very impressive, and having worked in a number of other areas around the country, it doesn't often get this good. So people are very much representing mental health. You have a set of champions here that won't drop this ball. For the next 5 years, you will see improvement year on year, and we are firmly committed to that.
Rachel, if you have your hand up.
Thank you. Yes, I just wanted to add my support really to the work that's been done around developing a strategy. And like Tim has said, it's taken over 2 years, because that's how you engage properly and refine, a plan. And I really commend the work that's been done on that. And public health have worked very closely with Tim in that. And I think that the joint working has meant that perhaps a plan that could be very much about how we change services has become, is clearly a strategy that is around emotional well-being and the full age groups as well, and looking at that and making sure they join together. So in the framework that we discussed earlier, the health and well-being strategy, one of the 4 priorities was healthy minds, and this strategy will deliver and sort of help guide some of the actual work under those. So it's just sort of making the link between that overarching framework that we've agreed and the work that Tim is leading and with colleagues under this, really. So just to make that link and show that what you can do with that strategic framework. But it's a delivery that's important, and we really welcome the investment that's been made available as well for this area, which we know has been hugely challenged over the next year. So I agree, it's all of our missions to really make sure that this remains the top of the agenda in the coming years, particularly for our young people. Thank you.
And thanks to Public Health, who put in above and beyond the resource into supporting me over the last 2 years. There is absolute synergy between the mental health strategy, Futures in Mind, and the health and wellbeing strategy. They're inseparable. They have been from the start. That was the plan.
Thank you. Any further contributions from around the room? Well, thank you, Tim. It was really, really encouraging to hear all the positive comments, specifically relating to Scilly, but also the work which is going on at a more regional level. I think the Health and Wellbeing Board has had an eye on mental health, but I think going forward with the current circumstances, we just need to have even more oversight and even more overview of the potential consequences. But again, thank you very much for all you've done, and we look forward to working with you over the coming weeks, months and years to make further improvements.
Thank you very much, Chair. Thank you.
Oh, we don't have a formal recommendation unless I'm missing anything.
Okay. It should have been to endorse the mental health strategy. So apologies if that's absent from the covering report.
It might be something I just missed off, but I think we can certainly endorse it. The wording you just said seemed to encapsulate it.
Yes, I can read it out just for clarification. The recommendation is that the board endorses the mental health strategy for Cornwall and the Isles of Scilly 2020 to 2025, set out at Appendix A and Appendix B of this report, and makes comments as required.
Thank you very much. Could I have a proposer and seconder for those words, please?
Thank you, Chairman. Councillor Francis, I'd like to commend the report and propose recommendations, please. Thank you.
Thank you.
Happy to second.
Thank you very much, Councillor Grottick. And again, Tim, on behalf of the entire board, thanks to all your team and to you for leading this and to all the work you're looking forward to do in the future.
Thank you all. Thank you very much, councillors.
Thank you. Our final Part 1 report is agenda item 10, which is our forward plan, which I think, Bob, am I right in you're going to take forward to us?
That's correct, Chairman. Thank you very much. The forward plan was first presented to the board in June 2019, and the board will now see this as a 3-year rolling forward plan, which seems more appropriately aligned with the 10 years of the Joint Health and Wellbeing Strategy as described by public health colleagues, and in reality often reflects the nature of pace of change for some of these areas of work. At the moment, the forward plan is essentially capturing agenda items, and a couple of points have been raised in this meeting today in relation to the September meeting, as well as the Better Care Fund, which is a recurring item. Thanks to Jill Thornton for providing a comment around the national position of the Better Care Fund for 2001-2022. That's not yet been confirmed. So we will be waiting on advice from government for that. There is plenty of other active work, obviously, with the breadth of the different organisations on the board and other aspects in relation to, say, housing and fuel poverty, as mentioned earlier. So there is a question about the value and use of the forward plan in capturing joint working, those best opportunities and focus as described by the Director of Public Health. And also in relation to the main priorities like mental health and the Joint Health and Wellbeing Strategy. Last, just simply to support smooth meeting administration, I'd just like to draw members' attentions to the dates for proposed future meetings. These are set as part of the council calendar at the start of each council year, but it'd be very useful to have assurance that those dates actually work for the board and we can work to that and support the board as required. So thank you very much. I'll open the debate for questions. Thank you.
Thank you very much. And again, on behalf of the board, I'd like to thank you for pulling it all together and to making it run as smoothly as it has so far. Could I just pick up on Part 4 of the report which you've put together, which is the review of governance? It's something which has been floated around probably for a couple of 3 years now, and we sort of haven't taken it forward particularly far. It was also picked up by the LGA late last year during one of their visits. I would find it helpful if we could look into that particular point a bit more to look at the pros and cons, advantages, disadvantages, opportunities, threats, etc. of maintaining either 2 separate boards or 1 combined board with Cornwall. But it's really just how we get there. So I don't know whether, Bob, you could liaise with the likes of Steve and Ashling and other partners just to produce perhaps a roadmap of how we take that forward. So we're not coming to any decision without giving a huge amount of thought.
Yes, I can do that, Chairman. I've had previous discussions with Leanne Martin, who is very much a governance whiz on the Cornwall Council side of things, and the process that would be required from their point of view, which is a little bit more involved than at the Isles of Scilly end. But yes, to draw up a pros and cons things, I'm more than happy to draw something together.
Thank you very much. And on that note, have I got any queries or questions from other partners in relation to this agenda item, please?
Rachel Wigglesworth, do you have something? Your hand up.
Yes, sorry, you beat me to it. I hadn't quite managed to get my hand up, but I was just going to, obviously, with the discussion around the workshop for the Health and Wellbeing Board, whether you want to add that in as an informal workshop that Anthony had suggested, or whether that's an agenda item to do formally. But I would imagine because it's a wider membership, it was going to be building on the membership of the board plus further partners. So potentially adding into that informal for the same date as the Health and Wellbeing Board item. I think that sometimes works well in terms of availability. And then my other comment was subject to that to that session where we hopefully agree some specific priorities from our plan on a page for the Isles of Scilly. Then that should inform the forward plan in terms of some of the thematic reviews, outcome measures, and sort of assessment of progress against those themes, depending on how we agree to focus. So for the years 1 and 2. So not suggesting specific ones preempting the outcome of that workshop, but that's a suggestion of how it could work.
No, thank you. Thank you, Rachel and Joan. I will add that and we'll do as suggested, because I think it did work very well when we had the workshop last year tied to the meeting.
Yeah. Would anyone else like to make a contribution to this agenda item at this stage?
Yeah, Councillor Smith. I just wanted to note, nothing specific in terms of themes. I think it would be sensible firstly for the Smart Island update to come to health and wellbeing. It's been some time since we had an update, and there are some cross-cutting themes there, particularly with fuel poverty. And also just suggesting that there's, as mentioned before, that kind of clear link up between the local nature partnership and the health and wellbeing board, because certainly the work as a nature partnership is much more heading in towards health and wellbeing, as I said, that kind of access to nature. So I think we need to consider some sort of link up. I'm not quite sure what that would look like, but just sort of raising that, really.
And I think some of the reports today give us a bit more leverage in that direction, don't they?
They certainly do, yeah. So maybe we can develop that offline.
Thanks for that.
Thank you.
Rachel, did you want to come back again?
Yeah, sorry, just a quick, without wanting to preempt things, the themes of the health and wellbeing strategy are sort of healthy places and communities, which covers the environment and sort of clear wider determinants like housing and fuel poverty. Then there's the healthy start, the healthy minds and the healthy bodies, and almost those four, whether you use the particular themes within them, could provide that sort of overarching thematic approach, even if it's more honed down within those. I imagine that would be a way of linking them. That was the intention. But you might want to hold off till September to decide.
I guess September doesn't seem too far away now, does it? 1st of August is just a handful of days away, so we're going to race through that, and before we know it, we'll be into autumn. Any other queries before we conclude today's meeting? So for the record, we've got 2 recommendations. One to do with accepting the forward plan and one to do with dates. Could I have a proposer and seconder just for the record for those 2, please?
I'll propose those, Joel.
Thank you. And a seconder?
Yeah, that's fine.
Thanks very much indeed. So that concludes our meeting today. It just leaves me to thank everyone for all the effort they've gone into before the meeting, getting the reports together. And I look forward to working in the direction of travel which we've instigated this morning. So thank you all very much.
Thank you, everyone.
Thank you. Thank you, Joe.
Thank you. Thank you. Well done, Joel. Thank you.
Thank you, Chairman.
Jonathan Smith
is now exiting. Unknown participant is now exiting.